Depression and anxiety affect millions of people throughout the world, and specifically millions of people in America. It's a very real diagnosis. It's a very real condition. It's not in your head. It's not something that's wrong with you. Your brain and chemistry has been altered through either toxins, your environment, or a trauma that you've experienced. This is not your fault. There's nothing wrong with you. So I want to let you know that you're in a safe spot with me. I understand what you're going through, and this affects millions of people. And so I just want to share with you kind of our program on how we approach helping people get over these debilitating behavioral health issues of depression and anxiety. We developed this program to help people that really don't want to go get medicated. I have a feeling that you're here because you don't want to be on medications for the rest of your life, and that you are looking for a solution that can heal you instead of just make you feel better temporarily. So the reason why we have this program is to help people get healed and have long-term remission from depression and anxiety. The reason that we can do that is that we focus on neuroplasticity, and we focus on your whole body, meaning there's a ton of contributing factors to depression and anxiety that are outside of your brain, that are in your body, that are in your gut. And so we have science-driven data that help us pinpoint where you're deficient in your gut, maybe in your nutrient intake. We have these things as part of our program to help us pinpoint where we can help you the most. So our program is a 21-day, intensive 21-day program. The first day you'd come in and we would do some initial consultations. Then we would get you started immediately in the theta bed. That's a 30-minute treatment. Then we'd take you over to the RTMS and hydrogen and RF foot detox room, and you'd experience those modalities. And that's the first treatment. Every day after that is similar to that. So if you start on a Monday, you'd do Monday through Friday doing those modalities. And then on Saturday and Sunday, you'd come in and only do the theta bed. The theta bed essentially is a modality that puts you into a theta state or a theta brain waves. And your brain operates on several different wavelengths, alpha and beta being the most active, like when you're awake, and gamma and theta are when you're kind of more relaxed and asleep. So theta state is the state where you are more open to learning. Your brain is not focused on protecting itself or protecting the body. It is open to learning and developing new thought processes. So it is a powerful modality that normalizes neurotransmitters and elicits neuroplasticity. So we use the theta bed to warm the brain up and to get it ready for the TMS. The TMS is a very gentle magnetic stimulation that produces neural activity, and that neural activity helps push new neural pathways. And that's what we want. That's basically what neuroplasticity is developing new neural pathways that are not connected with the past traumas of your life or past experiences. These are new pathways that are unassociated with past behaviors or past traumas. We also have you breathe in hydrogen gas at the same time. It's been studied and proven that a lot of our neurological issues, depression and anxiety included, there's a ton of brain inflammation in our brain that's preventing our brain from operating at an optimal state. So breathing in hydrogen gas helps lower that inflammation and gets your brain to a point where it can start not worrying about the inflammation and fighting off that, but actually producing new neural pathways. The RF foot detox, we use that to help stimulate a fever in your body. So your core temperature will raise 2 or 3 degrees, stimulating or eliciting a natural immune response, and your body is going to start looking for free radicals, zombie cells, and different things that just you want out of your body anyways, and it just helps the healing process as we move you to a depression-free life. Let me just tell you a couple experiences from past clients of ours. We had a couple come in that they were suffering from anxiety, severe anxiety, and a little bit of OCD. And the husband couldn't really work effectively. It affected his ability to function at work. The wife was completely bedridden at times when she had bad anxiety. It led to, I think, a little bit of obsessive compulsive disorder, and they wanted some sort of control in their life. So they went through our 21-day program, and they had great results. The comment that the husband made is that it's changed our lives. He's now doing great at work. He has had a better relationship with his wife. She's now been able to just be more relaxed and more present and not really worry and stress about what's making her anxious. One of the modalities we use is TMS, and TMS stands for transcranial magnetic stimulation. This is an FDA-approved procedure to treat depression. TMS is effective about 85 to 90% of the time on treating depression and anxiety. Most see a significant decrease in their symptoms, and the way that they feel it drastically improves. So TMS is a very great modality for people seeking for medication alternatives, and those people that medication doesn't really work all that well. Truthfully, TMS is only approved for major depressive disorder and treatment-resistant depression disorder. So you actually have to have tried antidepressants in order for the insurance company to cover this part of the program. We accept insurance for part of this program. We accept Blue Cross Blue Shield, Aetna, Cigna, Magellan, TRICARE, TriWest, Humana, Optum, and United Healthcare. And these are the insurance companies that we're provided and credentialed with right now. But if you desire to handle this without involving medication, then we do have cash pay. We also take care credit. We take HSA accounts as well, so that you don't have to experience the negative side effects of medication. Another great thing about our clinic is that we have multiple tools at our disposal to attack and treat your depression and anxiety. We have a standalone TMS program. We also have ketamine IV therapy that, again, isn't covered by insurance, but a lot of people see a ton of benefit from it. And that's something they're willing to do, and that's at their comfort level that they want to try. We also offer a nasal ketamine, which is called Spravato. This is covered by most insurance companies. It gives an option for those people that want to try IV therapy, but don't have the funds or wherewithal to do so. So we have a lot of different tools in the toolbox to attack and to help get you long-term remission from depression and anxiety. Our goal at Unchained is to give you lasting relief and long-term remission from anxiety. We look at a ton of contributing factors to depression and anxiety that other clinics don't look at. We are unlike any other psychiatric facility in Arizona, in that we give you the tools to evaluate your whole life, your mind, your body, to free yourself of anxiety and depression. I believe in this program, and I know that it will set you free from depression and anxiety. If you're ready to take the next steps and live a depression and anxiety-free life, click the button below and let's schedule a call with one of our patient care coordinators. We can further explain the program and get you scheduled for your first consultation. Take action now. We've got limited availability. You don't want to be living with depression or anxiety for any longer than you need to. Click the button below and book that call with us. It will change your life.